Her name is Jargal. She is a well-respected, trained physician in her homeland of Mongolia.
She have had a
On this trip, she's working as a translator for obstetrician Colonel Kevin Boyle. She's one of the first to point out the limited health care in the Gobi Desert. She says it's the major reason she signed on to be here.
Most of the herders are way out from a town, so they don't, unless they have a horribly sick, they will not come to the hospital to have any kind of care.
Like the rest of the Mongolian medical contingent, Jargal says the experience demonstrates the differences between medical techniques and procedures. She says it allows all the healthcare professionals the opportunity to observe and learn from each other. But she's quick to point out the biggest gap between them is technology. The Americans acknowledge advanced technology does give them a medical edge, but according to Dr. Boyle, taking a step back to old-time medicine is equally rewarding.
They get to teach me the instruments they use, like this is their fetoscope for using when women coming in pregnant to listen to the heart rate. One of the base things we learn here is the art of touching patients and trying to figure out what's going wrong with them just by using our hands. The most important instrument a doctor owns.
The first place human touch comes into play is in triage, a time-honored method of evaluation. It's where patient vitals and symptoms are recorded before routing them to the appropriate place. For Baji, one of 11 interpreters who've come from the capital city, it's a rare chance to lend a hand to his countrymen.
I mean, it means a lot because this is people from our country, so we really feel happy to help them.
Undran is also a translator. She says her work with Colonel McEwen is some of the best practice she could have.
She knows that? She knows they're the same or what?
Undran is a second-year medical student on her way to becoming part of Mongolia's healthcare system.
The relationship between American doctors and translators and Mongolian doctors are very good.
All the translators are young. English is only now becoming familiar. Thanks to the internet and MTV, young Mongolians like Baji and Undran are expanding their communication skills.
Is she taking any medicine?
The people they speak for, like these here in Dariganga, are the heart and spirit of Mongolia. Dr. Baksu, chief of the clinic, says the joint medical team is welcome. He says both his staff and the military team have rich experiences in common. And while he thinks the medicine is primarily the same, he says what sets them apart is life in this challenging land.
For Americans, probably they're not in this kind of environment, because the condition where they work is different.
Captain Takmal Supakhtar says he volunteered for this mission because he knew how much they could learn from each other.
The result is the same, but the way we treat the people maybe is different.
You can tell this has been a chronic infection because it's really, really thick.
At this moment, Lieutenant Colonel Greg Lee is confirming the captain's point. An orthopedic surgeon, Lee normally works surrounded by all the paraphernalia typically found in a well-equipped surgery.
Did he get kicked by a horse?
The patient is a young boy with a swollen leg and a suspect cyst. The operating room is a makeshift bed in a small cubicle. Back in the States, he would confirm his diagnosis with an X-ray or an ultrasound. Standard equipment, now seen as luxury. For Dr. Lee, time in Mongolia will be remembered not only for what he taught, but what he learned.
I think the old medicine works. It's probably what we practiced years ago, and it works. It's just that as technology gets better, we've found ways to utilize that technology to make healthcare better.
It's a scene out of the Wild West, except this is multiple time zones to the east. Reportedly, there are well over 3 million horses in Mongolia, more horses than people. Here, in the land of the horse, these small and sturdy taki are a national icon that trace their origins back to the 13th century and the time of Genghis Khan. One of the first things Major Connie Schmidt discovered is that they're horses, not ponies.
I've worked on horses before, but in the U.S. the horses are a little bit less wild, and these horses are much tougher and hardier than the horses I'm used to. And I've never seen a wound like this before. This is a deep skin infection, and right now we're trying to debride the wound by scrubbing it with a betadine and water solution. This is a saddle sore caused by pressure from an improperly fitted saddle, and we usually don't see that in the U.S.
Schmidt is an Army vet currently stationed in Japan. Because life in the Gobi Desert is a rural existence, the exercise planners were asked to include a veterinarian. The taki are working animals, prized for riding and carting, also for milk and meat. Once threatened by extinction, the Mongolian horse is making a comeback. This herd is used exclusively by soldiers of the Border Protection Agency, tasked with maintaining national security with neighboring China, just 3 kilometers away. Transporter threats include the prevention of terrorism, black market goods, and human smuggling.
Well, these horses are very, very nice horses. They're kind of tiny, but they're very sturdy and healthy, and they're very, very, very important to the people who live here.
Her fellow vets are border agency soldiers. Their job is to travel and treat the livestock of the Gobi, primarily horses. Captain Ink Amgalak says that because they are all trained veterinarians, they can overcome the challenges of communication. They can both teach and learn from each other. In their time together, they'll treat horses, cows, camels, goats, and sheep, using medicines familiar to all. On this day, they treat some 24 horses. Most have saddle sores, worms, and even pneumonia.
It's a racehorse, and there's a problem with his breathing. He's definitely got some congestion, something going on in his lungs. They sound very dense and harsh, so give it some penicillin and then see if that improves his wind. How long will it take this to heal?
Existence in the Gobi is undeniably tied to the health of the livestock. In turn, the health of the livestock is determined by life in the Gobi, which has considerable bearing on the health of the people.
Good morning. It's pretty descriptive of what we're doing. There's very little out here.
Captain Michael Attilio is a third-year resident in the area of family medicine. Like the others, Attilio is also on his first deployment, and like them, he calls Tripler Army Hospital home.
Back home, we have so many different things and exam rooms that I really didn't appreciate it until I got out here. You practice with a stethoscope, and that's about it.
He says, like the rest of the Tendon Mondale team, this is an opportunity to give back. He says he volunteered for this assignment because of selfish motivation.
Basically a chance to test my mettle a little bit before they really release me into the real world.
For 28-year-old Attilio, the real world is combat zones, like Iraq or Afghanistan, theaters where Army physicians can expect to go.
Does it hurt when I press on your back?
He calls Mongolia his training ground.
It's something I'm learning a lot from, both my interactions with the patients and how I practice medicine in general.
Mongolia is also making a lasting imprint on Dr. Mark Chun.
You get to do something totally different in a world that most people can't get to.
Different is an understatement. According to Dr. Chun, the conditions here in Mongolia are a far cry from what he normally sees back home.
He's been a dentist for 25 years. He's already deployed twice to Iraq. As an Army Reserve soldier, Chun has learned the lessons of balance.
Extract the upper one. Extract the upper one. That's holding.
According to Chun, his primary dental difference, besides geography, is in the numbers.
We did bring it.
Here in the Gobi, Chun will bring dental health to some 70 people, more than doubling what is normal in his private practice.
Even before we started to treat patients, they were already out, lined up.
He says exercises like this are a unique opportunity to see firsthand what reality means to these people.
As a general dentist from Kailua, Hawaii, this is awesome. Can't get any better than this.
In the end, 1,784 patients will be treated. This is the 5th year for Exercise Tendon Mondale, each iteration serving as a cornerstone for the next.